A second coronavirus vaccine could be approved as soon as tomorrow after an FDA advisory panel meets today. And that's a good news moment at an especially dire time. Daily cases hit nearly 250,000 yesterday. That is an all-time high. More than 3,600 deaths were reported at the same time. That is also a record. Our lead national correspondent, David Begnaud, is at a hospital in Fresno, California. David, good morning to you. Word is there it's a desperate situation where you are.
Yeah, look, we were told we're sick and tired of getting sick and being tired. That's what they said to us when we called this hospital the largest hospital in the Central Valley here in California. We started the week in Northern California, made the drive south, stopped here to check on them, and we found tents outside. They told us there are no ICU beds available. They have 450 employees who are out. Half of them are sick with COVID. The other half were exposed to COVID. They have more employees out than they have COVID patients in the hospital. And they're so busy with those patients, they're busting at the seams. In California, hospitals are doing everything they can to keep up, whether that means setting up beds in the hospital's conference room or tents in the parking lot outside.
Our bed capacity is 0.
Dr. Race Vora is an emergency room doctor here at Community Regional Medical Center in Fresno.
We see influenza, we see pneumonia. Really everything is coming in at the same time, in addition to this surge in COVID, and we're just running out of space.
But more help could be on the way very soon in the form of another coronavirus vaccine, this time from Moderna. Today, it goes before the FDA's Independent Advisory Committee on Vaccines. Dr. Arnold Monto is the acting chair of that group.
I think the discussion may be a little simpler because they are not asking for authorization in the 16 to 17-year-olds.
So if approved, Moderna would be available to people of what age groups?
18 and above.
As Moderna's vaccine gets closer to approval, doses of the Pfizer vaccine are now arriving at nursing homes across the country. And over the last 72 hours, tens of thousands of doses have made it into the arms of doctors, nurses, and seniors nationwide. But on Wednesday, officials in Alaska reported the first known instances of an adverse allergic reaction to the vaccine here in the U.S. It happened to 2 healthcare workers in Juneau within 10 minutes of each other. One fully recovered while the other remained in the hospital for observation.
She was still enthusiastic that she got the vaccine.
And then there are the stories of survival, like Natalie Herrera. The 35-year-old was hospitalized in Southern California with coronavirus at 37 weeks pregnant. Now, to save her life, doctors performed an emergency C-section and delivered her son, Felipe. But Natalie got sicker. She spent a month in the hospital, critically ill, unable to see her son. But on Tuesday, she got to go home and meet that baby boy. What is the first thing you did when you saw him?
I smelled him. I smelled his little head, yeah.
How sweet it is. I want to go back and talk about those allergic reactions. Listen, experts say those are extremely rare. But if you are prone to usually having a reaction with a vaccine, you should not get this vaccine unless you talk to your doctor and you guys agree that it's right for you. As for the Moderna vaccine, listen, it doesn't require those ultra cold freezers that Pfizer does. So Moderna could be more widespread, maybe even arguably more popular, because for the smaller nursing homes, doctors' offices in rural America, they can put the Moderna vaccine in the common freezer like you and I have at home. Gail?
Yeah, that is good news. I'm still stuck on the lady who smelled the baby's hair. I love that part of the story. Thank you very much, David.
So sweet, right?
It is. It is. I love that kind of moment. We need those. Thanks.